Okay, hello everybody. Welcome back to Twig. Twig stands for This Week in Global Health. Twig is a weekly live global health news roundup, and we have a theme this week. We have a theme every week. This week we're going to be talking about gender-based violence. We're going to jump right in and introduce the panel members. I'm going to start off with Kris. Kris, who are you and what are you going to talk about tonight?
Hi, everybody. I am Kris Ronsin, and I am coming to you from San Francisco, California. Tonight, I'm going to be giving you a little bit of an introduction into gender-based violence, what it is, and a number of different other topics. Too many to go into.
Okay, thanks very much, Kris. Next up, Caity. Caity in Sweden. Caity, what are you going to tell us about?
Hey everyone, my name is Caity Jackson and I'm coming to you from Stockholm, Sweden. Today I'm going to talk a little bit about some of the gender-based violence facts, and I'm going to do Caity's Career Corner.
Okay, can't wait for that. And then, of course, our science guru, Sulzhan. Sulzhan, talk to us.
Hey everybody, this is Sulzhan from East Coast, and today I'll be talking about gender-based violence and its economic impact, as well as a focus on organizations involved in working with gender-based violence. So stay tuned.
Okay, we will stay tuned. Thanks, Sulzhan. Okay, now usually we would have Brian Simpson from Johns Hopkins giving us the news roundup, but today we've got two items, and they're going to come from Kris and Sulzhan. Kris, what's your news item?
Okay, well, we wanted to share with you another major study that was just published in the Journal of the American Medical Association on the link between autism and vaccination, specifically the MMR vaccination. This study involved 95,000 children and was published, I believe, last week or this week, and it's proved yet again that the MMR vaccine is not associated with autism, even in children already at higher risk for that condition. So if you want a little more background information, we have episodes ranging all the way back to number 2 where we covered vaccination, as well as episode 21 where we talked about measles and got into a somewhat heated discussion about it. So go check those out.
Yeah, absolutely, and there's lots of information and science out there. The body of science out there that shows definitively that these vaccines are by and large safe and effective and have no association with autism. That body of knowledge is overwhelming. So if you're still skeptical, if you're a vaccine detractor, if you take a real look at the science, you'll find that in actual fact these vaccines really need to be taken. They are safe.
Yeah. And I like how you said, Kris, the link between autism and vaccines. And actually, there is no link between the two, but it's just kind of the situation that is developed.
The lack thereof.
There we go.
The spurious link. Okay, Sulzhan, you've got a news item. Hit us.
Yes, absolutely. So today happens to be the 45th anniversary of Earth Day. So 40 years ago, a massive oil spill in Santa Barbara, California, prompted the birth of Earth Day to focus on protection of environment. Today, it's a reminder that of the link between climate change and the global health risk due to it. So the links will be there in show notes, so definitely have a look to learn more about Earth Day.
Thanks very much, Sulzhan. Okay, Kris, let's jump right into a discussion on gender-based violence. Can you tell us what is it that we mean by gender-based violence? What is it?
Okay, so gender-based violence is essentially violence that is directed against a person on the basis of gender. Now, for this episode specifically, we're going to be focusing on violence against women. And this includes a multitude of things, and I think sometimes people don't associate these as gender-based violence. They include female genital mutilation, honor killings, domestic violence, conflict-related violence, sexual violence, and human trafficking, which is often female slavery, just to name a few.
Kris, while you mentioned, I was reading the other day that worldwide 1 in 3 women have experienced some form of gender-based violence. Now, that's a crazy number considering there are 3 women on the panel today. So that was interesting that I thought I would share. And you mentioned female genital mutilation. And I'd just like to kind of mention here that very often when we talk about gender-based violence, we think about domestic violence or intimate partner violence. But we forget that female genital mutilation also contributes a lot towards gender-based violence. In fact, more than 3 million girls each year are at risk for female genital mutilation.
Yeah, I think it's one of those things I remember hearing about sort of peripherally growing up and not really realizing that it was a practice. I sort of assumed, of course people wouldn't still do that. They know that it doesn't serve any health purpose or, it's just inhumane. It's a human rights issue. And there's actually a female genital mutilation awareness day to make people aware of the cause and that it's still being practiced. So it's definitely one of the most prevalent forms of violence out there in a number of countries.
Yeah, and just another, as we were talking about different ways that maybe, or different things that you wouldn't think would be gender-based violence. Child marriage is another practice not normally associated with GBV, but it contributes to it immensely. 64 million girls, to be total, are child brides, a practice that is rampant in both South Asia and Africa.
Okay,
So just to put that in there.
And I didn't know that, so thanks very much, Caity, for sharing that with us. Caity, I wonder if you can talk to us a little bit about the impact of gender-based violence on health and the economy.
Yeah, so GBV is not only a human rights issue, but also undermines health and security of women. It has both immediate as well as long-term impact on that persists long after the violence. GBV has been known to result in mental health problems, increased risk of HIVs and STIs, results in injuries, substance abuse, and death. It is also associated with increased mortality and morbidity in infants.
And additionally, women who experience abuse of any form are more likely to abuse tobacco, drugs, and alcohol. In addition, those are often causal factors for chronic disease. Well, abused women are about 70% more likely to suffer from heart disease and 80% more likely to experience a stroke.
Oh my God, like I did not know like the link between gender-based violence and chronic diseases. Like thanks a lot for sharing that, Kris. Oh my God. Yeah, and while we're on the topic, let's not forget the economic impact of gender-based violence due to direct health costs and also indirect cost of lost productivity. In fact, like just in US alone, the annual cost of gender-based violence is $8.3 billion each year. And this was a number from 2004. So
that's a lot of money. While we're talking about the economic impact of gender-based violence, Sulzhan, could you talk to us a little bit about the relationship between gender-based violence and inequity within a country?
Yeah, absolutely, Greg. So normally we associate gender-based violence with countries which have high gender inequity and conflict. But did you know that gender-based violence varies from 15% to 71% across countries worldwide? And this is just the intimate partner violence. So that's something to think about. US, incidentally, has a gender-based violence percentage of 24% women have experienced it at some point of time.
Well, and I think, too, when we were looking at the statistics for the rates of gender-based violence in these different countries, for both intimate partner violence and general gender-based violence, I actually think the 71% is full gender-based violence. But the highest rates were in Ethiopia. And I know a lot of people sort of, when you think about gender-based violence, you think about something like this going on. We think about FGM, we think about child brides. A lot of times, and this isn't a stereotype, it's just people sort of turn their thoughts to Africa. And I want to point everybody in the direction of a podcast that I was listening to the other day. It's from a podcast called Smart Women, Smart Power. And this episode was on women's empowerment and African development, and it features the chair of the African Union, and I'm going to try to say the name correctly. It's Dr. Nkosana Dlamini Zuma. She did a wonderful talk on the future of development and the fact that the theme for 2015 for the African Union is women's empowerment. So there's a lot of really fantastic information in there, and it's definitely something to check out. And Smart Women, Smart Power is a program through the Center for Integrated, let's see. Oh no, I'm totally blanking. We'll come back to it, but it's CSIS, and it's Center for, okay, you know what, no, I'm done. I'm out.
Well, listen, if you're watching the show and you're interested in working or getting involved with the fight against gender-based violence, what you're going to be wondering is what organizations are out there, who's doing what, who are the stakeholders, and I'm going to ask Sulzhan if she can give us a little bit of insight into that.
Sure, Greg. So there are a number of organizations which are working on gender-based violence. Global Fund for Women is one example, which is a San Francisco-based NGO that works with grassroots organizations to identify and fund innovative solutions against gender-based violence, especially for women. Other organizations that work on gender-based violence for women include CARE, Women for Women International, International Rescue Committee, Sonke Gender Justice, which is a South Africa-based organization, and as well as Women Living Under Muslim Laws. The links to all of these organizations will definitely be there in our show notes, and feel free to ask us questions about them in our discussion section.
Yeah, and there's a blog, and I'll put it, or a podcast, and I'll put that in the show notes because I'm definitely going to butcher this. But they discussed women living under Muslim laws, and it was a really interesting sort of expose into them. But as far as organizations themselves go, let's also not forget about UN Women, which was established in 2010 to combat gender-based violence and gender inequity. They often partner with governments and NGOs, both private and public sector, to guide policy, develop action plans, and increase awareness regarding situations such as gender-based violence. And to go back really quickly, the Smart Women, Smart Power blog is from CSIS, which is the Center for Strategic and International Studies. And I knew I was going to butcher that because it's too many similar sounds.
Thanks very much, Kris.
Okay, you're welcome.
I mean, tonight's episode, or today, depending on where in the world you are, this was full of really interesting information. I've learned a lot. Thanks very much for all the preparation and hard work that's gone into getting this show together. As always, at the end of the show, we have a little section called Caity's Careers Corner, or Caity's Career Corner, where Caity talks about some jobs that are available at the moment. If you're in the job market, you're looking for a place to work, Caity is the person to help you. We also, just to let you know, on our webpage, twig.org, we have all of these jobs listed there as well, the Careers Corner part of the webpage. But anyway, Caity, over to you. Tell us about job opportunities in the global health space at the moment.
Excellent. So today on Caity's Career Corner, I'm going to highlight 3 positions, and they're based with the topic we are talking about today and some of the organizations we mentioned. So the first one is from UN Women, and they have an opportunity for an intergovernmental support internship from the 15th of May to the July 31st with a possibility of extension. The deadline for application is the 23rd of April, and the link will be in the show notes and on the website. The second one is actually from someone that has given us this job posting, from Margaret Green at Kaplan. So shout out to Margaret. Thanks for sending us this way. So there's an internship in regulatory support for PDP products vaccine development with PATH, which is a great organization based out of Washington, D.C. The period of internship is from June 1st to August 28th. There is a stipend involved. A lot of the required skills are pretty basic, and they just ask that you have some experience with research and development. The third job is from Policy and Advocacy Specialist in South Africa with Sonke Gender Justice. I think I'm pronouncing that right, Sulzhan. So as mentioned before earlier, and all that is required, or some of the requirements, are advanced university degree, master's level education, or equivalent work experience in global advocacy, international law, human rights, or related field, with a strong expertise in gender. The link will be on our website and in our show notes, so make sure you sign up.
Okay, thanks very much for Caity's Career Corner. That was excellent. Just quickly, for those of you that are watching live, don't go away. We're going to have a discussion section, and this show will carry on. For those of you that are watching this on YouTube or listening to the podcast, the show's about to come to an end. But before you go, we're just going to tell you a little bit about Twig. Kris, could you just talk to us a little bit about how somebody watching or listening to the show can get in touch with us?
I most certainly can. So there's a definite number of platforms that you can get a hold of us on. Let's start with email. You can email us at hello@twig.org with your questions, comments, feedback, anything you've got. We want to hear it. Also on Twitter, we are at Twig Team, and if you check out the title bars at the bottom, we all have our independent Twitter feeds or Twitter handles on there for you to contact us at. In addition, we have a LinkedIn site, a webpage, at twig.org, and we also have a Facebook. So come and find us. Again, we want your input, we want your feedback. And one more thing too, we are now able to accept your blogs through the website. So if you have submissions, we're always looking for new bloggers. Please go ahead and contribute whatever you've got. Send it our way.
Hooray! Okay, I'm excited about that. That adds a lot to our webpage. It makes it a richer place to be. Sulzhan, there's a survey you've put together. Tell us about it.
Absolutely. So if you're interested in winning a surprise gift from Twig, so please take part in a very short 1 minute long. I promise it won't take more. 1 minute long survey.
We tested it. It's 1 minute.
Absolutely.
You've got a very short attention span, apparently. She couldn't make it past a minute.
No, a minute is where I start getting distracted. Like, ooh, look at these things.
So there are just 3 questions in there, but it would really help us to make our episodes better catered to what you like. And you can win a surprise gift, especially if you're an art lover.
I'm going to be a little bit surprised as to what the gift is as well. It's a surprise to even ask. Okay, and finally, Caity, can you just tell people about how they can watch or listen to this and previous episodes of the show?
Definitely. So we have made all of our previous episodes available on our website, twig.org. That's TWIGH. You can watch us on YouTube, on Google+, and we also have a great podcast that you can download so you can listen to it on your way to work.
Okay, thanks very much, everyone. Thanks for watching. Until next time, don't go. I was going to say don't go away if you're watching live. If you are watching this on YouTube, come back same time, same place next week. We'll be here. Thanks very much, everybody. Take care. Bye.